Thank you for joining us today. My name is Josh Wyatt here at Jones Advisory Group. I will be your host to talk about Medicare today. Real quick, I wanted to give you kind of a quick information. This video today is for information purposes only. This is for education. We are not affiliated with Medicare or any other government agency. What is Medicare? Well, Medicare is the largest insurance health program offered by the U.S. government, serving more than 62 million Americans. Also, it is run by the Center of Medicare, or CMS, Center of Medicare and Medicaid Services. There's actually three parts to Medicare. There's Part 1, which is basically original Medicare, which is considered Part A and Part B. And then we have Part C, which is a Medicare Advantage plan. And then also there is the prescription drug plan, which is Part D. So again, three parts of Medicare, and here they are. Now we're going to talk about when is the time that most people enroll in Medicare. It's called a Medicare Initial Enrollment Period. What that is basically you have, when you turn 65, you have 3 months before you turn 65 to enroll, your month that you turn 65, and after you turn 65, 3 months after. That's considered initial enrollment period. Or if you're newly qualified for disability, you may enroll even sooner than 65 based on some of those rules. So again, with Medicare, there is some options to enroll, but most people enroll typically when they turn 65. Also, notice on the side over there, there's your Medicare card. A lot of people throw that away. So if you ever get your card in the mail and it says Medicare Health Insurance, has your name and all that information there, and the dates correspond with when you're turning 65, don't throw it away. That's your Medicare card. Next, we're going to go into Original Medicare. So Original Medicare is offered by the federal government. They essentially paying the bills, and they developed this program. So Part A covers your hospital, your skilled nursing, your hospice, your home health care is covered under Part A coverage. Now Part B is also going to be under doctors. So think of doctor appointments, outpatient care, durable medical equipment, and physical therapy is all covered under Section B, and that's actually offered by the federal government. Now we're going to look at Original Medicare, and also Part C and D, which is a little different. So it's offered by private insurance companies. We have your Part C, which covers everything just like A and B coverage, like we talked about earlier. It may also include additional benefits like dental, vision, and wellness programs. Then we look at Part D, which is prescription drugs. Think of it, anytime I go to the pharmacy, I show my card and then I get prescriptions filled at my pharmacist. And those are offered by private insurance companies. Now there's a fork in the road. You have basically on the left side, you have the Original Medicare, which is A and B, plus a supplement like Plan G. Then we have a Part D plan, which is prescription drugs. So really, those parts there equal one option that you have on the table. And then the other option is a Medicare Advantage plan. On the right side, you have your Medicare Advantage plan, which is also known as Part C, that may include dental and vision and additional drug coverage, all kind of baked into the same plan. And as a reminder, that's through private insurance companies. So again, we can't have both. We have to choose one or the other. So with Original Medicare, we're going to explore the different costs that are involved in Medicare, which when it comes to Original Medicare versus Part C Medicare Advantage plans. Now as we look at Original Medicare that is offered through the federal government, most people will pay, if you've worked for over 10 years or 40 quarters and paid into FICA or Medicare, that particular premium's copay is $0 on the left side up there. Also, there's a deductible of $1,600 per benefit period. Now, if you go in the hospital stay, the copays for the first 60 days, you pay nothing. And then from 61 to 90 days, there's a $400 a day copay. And then from 91 to 150, it's $800 per day. Now, after 150 days, it's 100% copay, or out of pocket, excuse me. After 150 days, that's 100% your responsibility. Now, skilled nursing. So as we look at skilled nursing here, co-pays the first 20 days, Medicare pays it, so you pay nothing. And as we look at 21 through 100 days, it's a $200 a day copay, and after 100 days, you're paying 100%. Now, Part B over here you're looking at the premium most people pay is $164.90 per month per person. If you make more, you pay more. We'll go over that next. Also, with Part B, there's a $226 deductible once a year. And then there's an 80% copay, or 80%, excuse me, Medicare pays 80%, and then the other 20% is your additional copay. So as a again, to repeat that, 80% is covered by Medicare. They pay the first 80%, and the other 20% is your responsibility, which is uncapped, folks. So that could be a potential large bill down the road. Now, as we look at monthly premiums, they do fluctuate based on a 2-year look back. So in 2023, they're going to look back in 2021 and look at what you reported as your filing earnings. And if you're a single filer making more than $97,000, you pay more. If you're a joint file joint and you make more than $194,000, you could potentially pay more, and there's a grid there. If you fall in those categories, give us a call. We can look at options that Social Security has or Medicare has that potentially lower those premiums depending on the circumstances and the life-changing event of why those earnings were higher. Also, Part D could be higher also based on your earnings, the 2-year look back. You could potentially have additional premiums that Medicare will charge you. So premiums do fluctuate based on your earnings. So what is a Medicare supplement plan? Well, unlike original Medicare, Medicare supplement plan is offered by private insurance companies and insurance companies that require and offer the basic benefits of each lettered plan. And there's several different options which we can help you explore. So it helps pay, for instance, co-pays, co-insurance, and yearly deductibles, depending on the plan. Now we're going to look at Medicare Advantage Plan. So Medicare Advantage Plan, also known as Part C, Option 2, you have mirrors A and B coverage, just like original Medicare, but you may also include prescription drug coverage. You may also include wellness programs, dental, vision, hearing, depending on the plan. But you can't have both. Remember, we have to choose either original Medicare with a potential supplement or a Medicare Advantage Plan. Now, these are important dates to understand. During open enrollment period, which is October 15th to December 7th, that gives you a window that you can switch for effective date of January 1st for things to go into effect. You might be able to switch from original Medicare to a Medicare Advantage Plan. You might switch from a Medicare Advantage Plan to another Medicare Advantage Plan, or change your Part D prescription drug plan. So those are the windows that you have to switch during the time frame each year. So where do I start? Well, one of the things that you want to start out with is just familiarizing yourself with this Medicare 101, understanding your options, and also we can help navigate here at Jones Advisory Group. We can help get you started. Really what we do is we look at your health history, we look at your view on pay me now versus pay later in the sense of healthcare. We can talk a little bit about how that works in the sense of overall having original Medicare and a supplement plan that's kind of like pay me now versus a Medicare Advantage plan we consider pay later. So we'll talk a little bit more in detail about that. So what questions should I ask? Well, the prescription drug plan, as you look at the different type of prescription drug plans, those do change every year. Your medications may change every year, and some people pay $5 a month, and some people pay hundreds of dollars a month, and I have some clients spend $1,000 or more a month. It just depends on your health condition, your underlying medications. Then we look at dental, vision, and hearing. At what element of coverage do I need, if any? Dental and vision and hearing are very important things as we get older, so we want to make sure we have the right policy for that. What about a cancer policy? Do I have a cancer policy? Do I need one? Is that something in my health history or my family history? We can explore options. And then ultimately looking at, does it make sense for you to have a Medicare supplement policy versus a Medicare Advantage plan? You definitely want to make sure we cover those gaps that we talked about earlier. Compare to be prepared. So as you look and compare the different coverages that are out there, here at Jones Advisory Group, we can help navigate that Medicare maze and help you make the right choices and decisions. And so by that meaning, we can help you with the help of Medicare.gov Part D Finder, find the right prescription drug plan for you, and help navigate different plans from dental, vision, from either cancer, heart attack, and stroke policies. There's a lot of different options out there. But again, we help with the whole planning process. So what are the next steps? The next steps are simple. give our office a call here at 785-215-6675. Schedule a visit with one of our team members here at Jones Advisory Group. We call it a Medicare planning session. We'll go through your situation, we'll go through your health history, and we can help navigate your whole Medicare maze, and that way we can set up in a sense to help navigate when's the best time to enroll, what for you individually, what plan makes sense for me, potentially a Medicare supplement plan or a Medicare Advantage plan, and what Part D prescription drug coverage should I get based on my prescriptions and based on Medicare.gov's recommendations. So we can help navigate that whole space. So give us a call. We look forward to sitting down with you and helping you navigate the Medicare maze. See you soon.